Hi, I'm Dr. Allison Applebaum, and I'm a clinical psychologist working with family caregivers of patients with cancer. Through my professional and personal experiences with caregiving, I've learned what it's like to feel overwhelmed with information. In this video, we're going to talk about the best way to talk with your loved one's cancer care team to get the answers you need. As a caregiver, you're often the link between your loved one and the cancer care team. In general, the care team can share information with you anytime you're with the patient, but there are laws that protect private health information. These laws affect what medical information your loved one's care team can talk to you about when they aren't present. So here are a few things to keep in mind for accessing their health information. First, have your loved one fill out a release form that lets the doctor discuss their care with you and any other people that may want to provide access to. This is called a HIPAA form, and the doctor's staff may call it a privacy or a confidentiality form. Second, be sure there's a copy of the HIPAA form and any other necessary medical release forms in the patient's record and in your own files as well. Finally, don't forget, when you call the doctor's office, they may need to verify that your name is on the HIPAA form, and they may need to verify your identity so they can discuss the patient's care with you. You may want to be involved in all levels of your loved one's care, from deciding which doctor to see to what treatment plan is best. Finding the right doctor and knowing what to ask during your time together will help you to feel confident in your loved one's care. Let's talk about these a bit more. Finding the right doctor is a big decision. I'm sure you know that cancer treatment often involves more than one doctor. There may be a team of doctors, nurses, and other people providing care. You might get information from many of these people, but it's a good idea to pick one doctor to be the one you go to with specific questions. Most people choose the doctor they see most often. In choosing a doctor as your main contact, some things you may want to ask are, will you be the one to coordinate care? And will you keep the other doctors updated on what's going on? Your loved one should feel at ease with a doctor, and you should too. But sometimes it takes a little time and work before this happens. Take the time to ask your questions and make your concerns known. Making the most of the time with a doctor is extremely important. The average doctor's appointment is about 10 to 15 minutes or even less, so it helps to be ready for each visit by writing down the most important things you want to talk about. For instance, what symptoms or side effects do we need to tell the care team about? When did each one start? Does anything help them to be better or worse? The American Cancer Society has a downloadable list of specific questions on cancer.org/questions, where you can find information about cancer types, treatment, and side effects. Print one of these lists and take it with you. That way, you can prioritize the questions you want to ask, and you won't forget anything important. Don't leave the office until the doctor answers all of your questions and you both understand what to do next. If your loved one is getting test results, be sure you understand the results before you leave. If blood work or other tests were done, find out when and how you'll get the results and who will tell you what they mean. Take notes on what's said to you. A voice recorder can also be a very useful tool. Most doctors and nurses are comfortable with their patients using one, but be sure to ask before you do. Thanks for watching. For more videos in our Caregiver series, be sure to check out cancer.org/caregivers.